Welcome. Today I would like to discuss a phenomenon with you that many patients describe during lengthening. A painful snapping sound in the hip area that often makes patients pause and feel unsettled for a brief moment. This phenomenon occurs regardless of whether an ITB release has been performed or not. However, it is more common in patients without an ITB release. We now perform an ITB release as standard. The ITB is only left in place for patients who explicitly do not want it. This snapping phenomenon usually occurs for the first time as soon as there is a certain amount of tension on the muscles. Generally from 1.5 centimeters of lengthening, rarely earlier. Many patients then confuse the snapping sound with a click, or are worried that something worse has happened to the leg, bone, or nail. First, I would like to briefly discuss the anatomical basics with you. This is important in order to understand how this snapping occurs and what can be done about it. If we now look at the thigh from the side, we see a relatively tight fiber structure in the lateral area, which is held by a muscle at the upper end towards the hip. This muscle is called the tensor fascia latae, or TFL for short. This goes into the so-called iliotibial band, or ITB for short, which runs from the side of the pelvis to the lower leg. This structure runs directly over a bony protrusion in the thigh area near the hip. Strong frictional forces arise between the muscle and this protrusion of the thigh. For this reason, there is a so-called bursa, i.e. a bursa that buffers the friction and pressure forces. In this illustration, the muscle and the ITB have been removed, and you can see the bony protrusion directly. Above this is the bursa, which acts as a sliding zone between the bone and the muscle. This bony protrusion moves forwards and backwards with every step and constantly slides back and forth under the muscle. When the ITB is under normal tension, the bursa compensates for these sliding movements excellently and prevents irritation and damage to the muscles. Because the ITB has a very high proportion of connective tissue fibers, it is very difficult to stretch it during leg lengthening, so that the tension in the lateral area almost always increases disproportionately. For this reason, we regularly carry out a so-called ITB release to make things a little easier for the patient, at least in the first few centimeters of the lengthening. If the tension in the lateral area increases during the extension, the pressure on the bony protrusion of the thigh, and thus the pressure on the bursa, also increases. This can lead to irritation of the bursa, and therefore to pain during movement, particularly when turning the thigh inwards or outwards, or when swinging the leg forwards. Sometimes the tension in the lateral area is so great that the muscular part snaps over the bony part of the thigh. I will first demonstrate to you on a model how the elastic band snaps over the femoral protrusion, and then show you clinical videos. This snapping is usually very unpleasant and painful for the patient, as you can imagine. In all cases, however, the reason is the increased tension in the lateral thigh area. This then leads to the change in the tension situation and the snapping. At the same time, the increase in the pressure on the bursa usually leads to irritation and painful swelling of the bursa, which makes the situation even worse. The treatment of this situation aims to reduce tension and relieve irritation. In general, a short episode of about 5 days of a non-steroidal anti-inflammatory drug, e.g. ibuprofen, helps. Moderate shockwave therapy is also a very good alternative. In addition, care must always be taken to ensure that the lateral area is sufficiently stretched. As the ITB or the lateral area becomes increasingly looser, this snapping also reduces until it finally disappears completely when the tension is balanced. It may be necessary to adjust the stretching exercises slightly. If the patient has not yet had an ITB release, now would be the time to recommend it, as otherwise the tension is likely to increase as the lengthening process continues.